Okay, welcome. This is welcome. This is the fourth episode of the JCMC interview series. Today with us, we are with Anthony James Cartwright, who is a consultant anesthesiologist at the Cleveland Clinic Abu Dhabi. And here I am Michele Introna. I am neuroanesthesiologist at the Istituto Best of Milano, and I'm also social media editor of the Journal of Clinical Monitoring and Computing. So welcome, Anthony.
Thank you very much, Michele. It's a real privilege to be asked to speak to you and to run through some of the run through the outline of the publication that's coming out in the next few weeks.
So today we are discussing about a nice review that came out in April in Journal of Clinical Monitoring and Computing, which is very interesting topic, and it's quite rare to find such reviews in the specialized journals. So it's particularly a pleasure to be here discussing it with its author. The review is titled "The Elephant in the Room: Cybersecurity in Healthcare." So we are talking about really nice topic, really relevant for our profession, but still not very discussed. So if we could just start on if you could tell us in brief what this review is about.
Certainly, Michele, thank you very much. I started writing this for my master's as a dissertation. I've always been interested in computing. And this developed during my master's in healthcare informatics into looking at the cybersecurity, particularly around COVID, because a lot of things changed around COVID. There was a huge move to working from home, using different systems to engage with patients, and indeed a whole plethora of new technologies that came into our sphere in anesthetics and intensive care, which were engaging with the electronic health record. So I looked at a lot of this. I looked at a lot of the history, some of the cybersecurity, some of the issues that we've had in the past and ongoing, and really delved deep into the information to pull out some of the tenets, some of the real themes that we're seeing coming through, the themes of attacks and vulnerabilities going forward. And like I say, particularly in light of the changes with COVID, and the working from home is a huge issue, and the increasing use of, ironically, Zoom and other conference or software. So really, that's where it came from. Looking at the advantages of this technology, but also the vulnerabilities. And I think the vulnerabilities are often overlooked. And if people understood the vulnerabilities and the risks, I think they pay a lot more attention to how they handle some of their own personal data and also the data that they work with in their workplace, not just in healthcare, but other sectors as well.
I think, the review is very detailed, so I invite all the listeners and viewers to read it. If you could summarize the most relevant data contained in the review, because when we talk about data, and I think the key message is that you give a lot of tables, graphs, data on how relevant is this problem for our profession today.
Okay, during the review, I looked at the incidence. Really is one of the concerning things, especially in relation to COVID. With cyber attacks, the issue really is the volume of data that's taken. The number of attacks that happen can be very low, but the volume of data can be huge. One attack in 2017 revealed over 78 million unencrypted medical records in one attack. Now, this is only on the increase, and it is exponentially increasing with the changes that have happened during COVID, with the vulnerabilities that have been seen within healthcare by individuals, groups, even states that want to access this information. So really the main summary is looking at the increasing incidents, looking at our vulnerabilities in healthcare and how we can mitigate some of those vulnerabilities.
And regarding the anesthesiology, anesthesiology and critical care profession, what do you think an anesthesiologist, let's say the normal clinician, as I can be, not being an informatics expert, what can I draw from such a review? I mean, what do you think would be the best approach for a clinician in 2023?
I think that there's two things that any clinician can draw from this, and anesthesia and intensive care really, I view them as one of the critical areas at the moment for being vulnerable to any sort of attack because of the technology, the volume of technology and the volume of instruments that we use. There's two things really that I would like any clinician to take home. The first is that if a device is not behaving as it should, maybe that should be questioned. We know through previous publications that one of the main manufacturers of anesthesia machines, two of the models have the ability to be hacked externally very easily, and gas flows changed, inhaled anesthetic concentrations changed, alarm settings changed without telling the user that they have changed. That can be done externally very easily. The same with some of the infusion pumps, they can be changed externally without the user being aware and being forced to give boluses. So when you're dealing with something like norepinephrine or insulin, clearly that potentially could be fatal. So if your device is not behaving as it should and your clinical judgment doesn't match with what the device is telling you, maybe just have that at the back of your mind, that maybe the device might not have been hacked, but it might also be broken. It might not be delivering 0.1 mics per kilo per minute of an infusion. It might be delivering a multiplier of that. So I think I'm very aware of the clinical situation. And it's one of the things I try and teach my residents is that if you've got a machine, don't just look at the number, look at the patient. If the SATs say, if the heart rate says, I don't know, 100, and you don't think that's right, feel the heart rate, it might be 50, it might be miscounting. Trust your judgment. Don't necessarily trust the machine verbatim. That's the first thing, just to consider that these machines are not infallible. Not only can they be hacked and give erroneous treatment to the patient, they can also be used as a gateway to get into the electronic health record system. So somebody can access that machine, even an infusion device, and then jump through a series of network hoops and have access to the electronic health record. The second thing really to take away is the personal use of the internet, your email, and also your own Wi-Fi networks, both in the hospital and also if you're accessing your electronic health record externally, away from the hospital. This is really quite important. We've all been to coffee shops where you can use the internet, and you see lots of people, often businessmen, sitting there with their laptops doing work. And they'll be logged on to the generic network within that coffee shop. Everybody assumes it's safe. With a very small piece of technology and with no time at all, I can sit in that coffee shop, set up a network with the same name as that coffee shop, and have all of your data as it's streaming straight through. So if you're accessing Epic or Cerner or any one of the other electronic health records, I'm stripping that electronic health data as it's going through. So external networks are not safe. With respect to email, be very careful about links, particularly with work email, because a lot of the links from externally, or some of the links from external emails, can be erroneous. They can be malevolent. They can fire macros in order to get access to certain parts of health record. And you might not even know that's happened. It doesn't come up with a big black screen with big red light writing on it saying you've been hacked. It can just sit in the background and fire away and look at your keystrokes. All of a sudden you put in your password into this thing and it's been sent out. So really it's thinking about the technology. Is it working as it should? If it's not, is there an issue there? Also thinking about your personal data, how you're using your email within the hospital and networks within the hospital. I think these are the two things I would want to take away. I want someone to take away from the article.
My personal feeling is that on this particular topic, there is quite a lack of education among clinicians, among hospital workers, because what I see, but I'm not sure it's the same in other countries. But in my environment, the level of warning between clinicians, among clinicians regarding this issue is very low. I mean, there is a very light approach on the problem. I mean, as it's not seen something as a clinician you are accountable for, you know, which is basically not true. Because when you're exchanging informations with patients or between colleagues regarding a patient using internet devices, it's quite a dangerous thing to do. But why do you think the alertness of clinician is so low if he's like I'm saying?
I think it's not just clinicians. I think everybody is very unaware of the risks involved with cybersecurity or lack of cybersecurity. We've grown up in a world. I can remember watching programs as a child where doors opened automatically, and that was magic. How did that happen? Because you approach the door. Now we're in a system where this morning I went for a bike ride, and one of my friends was commenting on my heart rate before I'd even finished my bike ride. So that's the level. That's the steps that we've gone through now. I think we've grown up with this. It's a bit like the frog in a pan of water. You turn it up gradually and it never notices. And we've gone from the Nokia phone where all you can do is send a message to now sending text to now sending a picture. I remember that one coming out. And now we've got this device, like I say, that sends my heartbeat 3,000 miles away to the UK and my friends commenting on it. And this has happened so gradually without any of the risks being highlighted. And as we were discussing a little earlier, sometimes when I speak to people and explain some of these risks, I sometimes have to stop, because when you actually explain the reality of what people are doing by sitting in a coffee shop with their phone or other things, people get very, very, very frightened, because the risks are quite unnerving, that all of your data can suddenly go. And we talk about medical data. You touched on physicians sending data between each other, medical record numbers, this sort of thing. A medical record file of one patient is worth up to $1,000, because that file is not just a history of their medical condition or their medication. It has their full name, their address, their telephone number, social security number, insurance details, often credit card details, next of kin, height, weight, any distinguishing marks. Now, any of this can be taken and used and then create a new credit card or a loan or access prescriptions for controlled drugs. So this data is vital that it's secured. And in the way that sometimes we share this data, we need to think very, very carefully about, is this secure? Can somebody read this data and take it? One piece of data is worth up to $1,000. I mentioned earlier there was an attack in 2015, and 78.8 million records were taken. Now you add 3 zeros to that, and that's an awful lot of money. And there's the incentive for taking this information. So I think we've grown up with this technology gradually. The risks haven't been explained. We don't understand them, but when we do, when they're explained to us, it's almost that, well, it can't happen to me. You know, this won't happen to me. I've never had a problem. And, you know, I think now we're at the stage of people are starting to realize that there is a problem, because it's fairly frequent, certainly in my work, and I would think others, where people say, my credit card's been hacked, and they've taken $1,000 or something, 100 euros. And this is very common. I've had 2 cards hacked in the last year. And you think nothing of it. You cancel the card and move on. But with health data, you can't do that. You can't cancel the health data and move on. That data is your data. If you've had an appendix in 1996, you had an appendicectomy in 1996, you can't move that. You can't change it. And that's the unnerving thing about the health data and how it has to be so secure.
And what I always wonder when I read in the newspapers about these hacking attacks, what do you think the stakeholders should do? I mean, what is the best approach if there is some stakeholder listening to us? What do you think should be the best approach when dealing with this kind of attacks?
I think the three things that I try to think is, first of all, prevention. That's the biggest thing. And to be fair, the majority of attacks or data leaks are from internal issues. Staff making mistakes, losing a USB stick, losing the laptop, the work laptop, these sort of things. Those are the majority of the actual breaches. In number of files, it's the hack taking the data. Now, the data is worth money, and also stopping the system is worth money as well, because you can then charge often Bitcoin. You know, I want 100 Bitcoin so that you can turn on your systems again. The first thing is there has to be transparency. There has to be very, very quick response and recognition that this is happening. And that has to happen at all levels. Even the anaesthetist using the EMR, if he notices that something has gone wrong and he suspects that's the case, he needs to flag that immediately. There needs to be a data breach response plan. So if a hospital doesn't have that response plan in place, it has to get one in place, so that when this is highlighted and it happens, there is a very, very fast, transparent response. You will find that each region and each country will have its own data response plan, a data breach response plan, and the UK has theirs. And during the WannaCry attack of 2017, it worked very well. And it sounds dramatic, but it does involve including governmental level and defense level communication, so that can be incorporated to try and stop the attack on maybe one hospital from spreading to other hospitals and other units. So it has to be isolated very quickly. When there is an attack, this comes back to the preparation side of it. As part of preparation, there should be a backup, a secure backup of data every day, so that if there is an attack and it takes the main system down, you can move hopefully fairly seamlessly into the backup mode, the backup system, and continue clinical operations. If that's not possible, we have a system where I work, we switch to paper forms, and you go old school with a piece of paper and a pen with pre-printed anesthetic charts, and they scan them in when it's all back up and running again. So that's the extreme side of it. And then recovery. Restoring and replacing the data is paramount, and correcting any damage to things like websites, email servers that have been harmed, and adapting your system to prevent a further similar attack. The biggest thing I would like to stress to any stakeholder is prevention is the key, is the absolute key. The biggest source of attacks are not external forces coming in and taking hold of your system. It's the caregiver reading an email about, I don't know, somebody trying to raise some money for a fluffy puppy, and click on the link, and boom, that's it. It's about education, educating the staff, having a system whereby each email has a highlighter at the top saying external email. Just make you think a little bit more about the security of the email. Regular phishing tests. We get them where I work, where you send emails and it looks genuine, and there might be some spelling mistakes or something a bit odd about it, but you click the link and IT are on the phone to you asking you to be retrained. So it's about education. That's the biggest thing is educating the whole staff, everyone from the cleaner to the CEO, about how to manage their internet activity, the email activity, and having a zero trust policy. Don't trust it. Assume it's untrustable until you know that it is, not the other way around.
Yeah, this is really interesting. We had in Italy an attack a few months ago, and all the data of all the citizens were stolen from hackers of in the entire region. And I guess they're still online. So when the data when there is a leak, so data are online, is there a way of having them cancelled, or is there a way of to fix the problem? I mean, because in that case, our politicians, I mean, the politicians in the stakeholders in the region, they decided not to pay the hackers. But we as Italians, we knew it just afterwards. I mean, everything was already done. So they decided not to pay, and in this case, the data are available, and I guess they are still available online.
Yeah, once the data's out, it's very difficult to have the data cancelled. Encryption is vital at source. So if the data is stolen, it's very difficult to then unencrypt it to have it usable. Not impossible, but as I mentioned previously, 80 million records in the States taken completely unencrypted. It's unbelievable that that's possible, but once the data's out, it's out. And it's not publicly available, but it does circulate down on the dark web. If you have an Onion browser or a Tor browser, you can access this sort of stuff. And the data goes for money. It's worth a lot of money. So there will be agents out there wanting vast sums of money for this data. Like I say, once it's out, I don't think there's an awful lot that can be done to put it back in the box. It's out there, and people want money from it. And maybe I'm wrong, but that's certainly the impression I have from reading through my degree and also the publication. I think what you have to do is, as an individual, once you realize that data has gone, is to think carefully about your own situation. So things like, if you have the same password for everything, change them, make them individual, because that password may well be something in your medical record. It could be your wife's name, or your wife's date of birth, or your son's favorite football team. All this stuff can be hidden in the medical record, and if they find that little key, and all of a sudden they've got your email, they've got your eBay, they've got your Amazon, they've got everything. So change passwords. If anything like this has happened, change passwords. Assume the data is there and they've got it, and do what you can to defend yourself. Changing passwords is the first one. If you see anything suspicious at all, assume that somebody has used that data. And again, change the password, follow it up. I think really that's the best thing. It's not a case of deleting the data, it's about changing the data.
Yeah, I mean, the aim of our talk today is to increase awareness, is not to scare people, because when every time I listen to something similar, the first reaction is first hour after the conversation you are scared, and then you tend to forget, you know, and the awareness decrease. But we should really keep high the awareness on the problem, and convince our managers and the stakeholders that this is an issue to talk about, to discuss, and to fix in advance, as you said, prevention. Because when the data is leaked, it's too late. What you're saying.
Yes, it is. It's exactly that. Once the data's gone, it's gone. As we found, Singapore had a similar attack. Was the president of Singapore's medical records leaked, weren't they? About 18 months, 2 years ago. So they happen fairly regularly. But yeah, it's about making yourself safe, having the right systems in place in the hospital or the environment that you work in, having regular phishing tests, having the training. Having an IT department that is up to scratch, has the funding. That's the biggest thing, is the funding and the right people. And healthcare has been notoriously lackluster in providing sufficient funding. Even the response to the WannaCry attack of 2017 in the UK, the money provided by the government didn't even put them on a level footing with industry. Industry spends a huge amount of money on this. Healthcare spends almost nothing. So really, we're setting ourselves up. But you're right. It's very easy to become scared about it, but you have to assume that this can happen and prepare yourself. Change passwords. My wife constantly nags me because I don't have the same password for all of the different things, and they're all random characters and brackets and dollar signs. But it's important that that is the case to make sure that you're safe.
And will technology help us a little bit, maybe with the digital recognition, retina recognition? I mean, because it's difficult when you have a bunch of passwords to change them all, to remember them all. So it's easy to fall into the trap of using one password for everything.
Of course, one password for everything is probably the one extreme. I'm almost certainly at the other extreme. With facial recognition and retina recognition, and fingerprint recognition also is good, but using biometrics is a good solution. We are very secure in the country that I work with. General cybersecurity around things like utility bills, driving licenses, all this stuff is it uses a lot of biometrics, but it can sometimes go a little bit. It can be counterintuitive. There was a system I used to use with my bank to provide a transfer between my bank account and somebody else. It used to use it would send you a one-time password, and you put that in, and it would work. Then they switched to using face, and the face would be compared to your facial characteristics on the police records, which we all have here, and sometimes it didn't match. Because of maybe it was lighting, maybe you'd had a bad night and you had bags under your eyes, maybe you'd had a haircut, something didn't match. And in fact, I've turned that feature off. I've disabled it. I'm back to one-time password. So as we progress through ever increasing layers of technology and security, sometimes, whilst it seems a logical thing to do, sometimes it doesn't work as intended. But biometrics are a good solution.
Thank you. It's really interesting, but also our time is running out. So I would like to thank Anthony once again to be here with our interview series.
Thank you very much indeed, Mikhail. Thank you. It's been a real pleasure. Thank you. And I hope I haven't scared people too much.
Exactly. I hope that everyone is listening is a little bit more scared than it was before starting to listen. So the episode is over, and I invite all the listeners and viewers to follow us on YouTube, Amazon Music, and Spotify, because if they follow us, the increased number of followers will increase the possibility for us to upload nice contents for the public. So thank you once again. It was really nice to meet you.
Thank you very much indeed, Mikhail. Thank you.
Thanks.